This is Motivational Interviewing by Antoinette Scott, Katherine Ziegler, and Michelle Solt for Georgia Southern University, Nursing 8137. Motivational interviewing is a collaboration between the patient and the nurse practitioner that focuses on change. It is important that the term collaboration is included in this definition, as motivational interviewing truly is a collaboration between the healthcare provider and the patient. The roles aren't always equal, but both people involved in this interaction play very integral parts in helping the patient move toward positive change in their life. This type of interaction focuses on strengthening a person's own motivation and commitment to change. Miller and Rolnick write in their book Motivational Interviewing that in particular, motivational interviewing is about arranging conversations so that people talk themselves into change based on their own values and interests. Miller and Rolnick were intentional in their text to write that the change is based on the values and interests of the patient. Ensuring that the basis for change is based off the patient's values is a distinguishing attribute of motivational interviewing and one that works to prevent defensiveness on the part of the patient. The authors continue on to say that attitudes are not only reflected in, but also actively shaped by speech. This is why motivational interviewing is able to affect change in areas of people's life that they've been struggling internally for years. Being able to walk through and talk through issues with nurse practitioners leads to an increased likelihood that change will occur because attitudes are actively shaped by speech. The basic principles of motivational intervention are rooted in client-centered psychotherapy. This is evidenced by the emphasis on acceptance, egalitarianism, and optimism regarding the client's own ability to find the best solution for the problem under discussion. Within this model of psychotherapy, the healthcare provider focuses on being with the patient rather than just subscribing to traditional intervention. The foundational work of motivational interviewing began a decade before its inception. In 1972, Beam's self-perception theory was published. This theory focused on how a client's perception of him or herself could be shaped by language as it emerges through a social interaction. This later became an integral part of motivational interviewing. In 1981, Bream and Bream published their work regarding reactance. This work forms the backbone of motivational prescription against inducing resistance and choosing the right moment to move forward and suggesting actions. The works of Beam and Bream may have never been applied to motivational interviewing had it not been for the founder of MI, Dr. William Miller. Dr. Miller did a summer internship at the Wood VA treatment program working with alcoholics. He had previous experience with psychotherapy, but no previous experience with addicts. Miller simply listened and observed, as he had no expertise or knowledge on how to intervene or offer suggestions. He was able to form relationships with the patients and felt they were being misrepresented in the current literature on addicts. After his internship, he dove headfirst into research on alcoholism and began treating addicts. He trained his therapists to interact within the realms of client-centered psychotherapy. His interventions with patients were far more successful than traditional cognitive behavioral therapy had been, and the results occurred in much less time. In 1983, Dr. Miller went on a Norwegian sabbatical to further the usage of motivational interviewing. It was on this trip that he was questioned by graduate students as to how he developed his approach. This inquiry led to explanation, which sparked the self-exploration within Miller. After this self-exploration, Miller published a paper in 1983 explaining motivational interviewing and separating it from cognitive behavioral therapy. In 1989, Dr. Miller was invited to Australia where he met Stephen Rolnick. Rolnick had been a fan of Miller since his original paper was published. Rolnick convinced Miller to write a book explaining motivational interviewing so that other clinicians could understand it and incorporate it into their practice. Miller invited Rolnick to join him in this venture, and together they wrote and published the first book on motivational interviewing. The third edition of this book is where the majority of the information included in this presentation came from. After the publication of this book, motivational interviewing gained popularity and became an integral part in the treatment of addiction. Motivational interviewing does not subscribe to either of the traditional schools of thought. These traditional schools of thought were directing and following. Directing gives the nurse practitioner a paternal role in which they provide information and advise the patient on what is the best route to change. In this school of thought, the nurse practitioner takes a dominant role in the interaction. The patient is only given two options. They can either be obedient to what the nurse practitioner suggests or deviant. An example of this would be a doctor telling a patient how to properly take their prescription. While this is an example of an appropriate use of directing, there can be many negative implications when directing is used in other realms of patient interaction. Following is the opposite of directing and gives the nurse practitioner a more passive role. Motivational interviewing falls in the middle on the continuum in an area called guiding. This middle ground of guiding incorporates aspects from both directing and following and has its roots based firmly in the values and interests established by the patient. The nurse practitioner in motivational interviewing serves as a guide rather than the director or the follower. Example from the text by Miller and Rolnick is the following. Imagine going to another country and hiring a guide to help you. Not the guide's job to order you when to arrive, where to go, or what to do. Neither does a good guide simply follow you around wherever you happen to wander. A skillful guide is a good listener and also offers expertise when needed. This image of a skilled tour guide gives a good visual of what role the nurse practitioner has in motivational interviewing. There are four basic processes of motivational interviewing. Engaging with the patient leads to a positive working relationship and sets the stage for positive change. Positive engagement is made possible through the establishment of a trusting and mutually respectful working relationship, agreement on treatment goals, and collaboration on mutually negotiated tasks to reach these goals. This is the initial step in patient treatment and works towards the result of a therapeutic relationship. Next is focusing. Focusing involves clarification on previously set goals. This is an ongoing process of seeking and maintaining direction to form specific, achievable goals. Next comes evoking. Evoking focuses on the patient gaining recognition of change talk and knowing how to evoke and respond to it when it occurs. Strengthening change talk leads to positive change. The goal of planning is to move from discussing importance to developing a specific change plan, and this is one that the patient is willing to implement. These factors occur in the order they appear in the slide and all work together to make motivational interviewing both distinct and effective. These processes are both sequential and recursive. You cannot have one without the other, but they build upon each other. Milner and Rolnick display these as a stair step in the text, and it can be visualized in this picture. A large part of motivational interviewing is dealing with ambivalence. Ambivalence is a common human trait that exists when someone both does and does not want to exact change in their life. This is seen in addicts and was an integral part in the development of motivational interviewing. It is important that the nurse practitioner recognizes ambivalence as a normal step in the change process, not as deviant behavior. Ambivalence has been human nature since the dawn of time. When an ambivalent person debates change, there are two voices that are present: the voice that expresses change talk and the voice that expresses sustained talk. These are not literal voices, but are internal debates that are present in an ambivalent patient. Change talk is the part of the person that is arguing for the positive change. Sustained talk is the part of the person that is arguing against positive change. An example of this would be, I need to go on a diet and lose some weight. I know it's not healthy to be this weight. This is the change talk. The other end of the argument is the sustained talk that argues, but I get so irritable when I'm on a diet. I think it would stress me out too much to combine grad school with a diet. My husband does not deserve to deal with the monster that I become on a diet. This is a good example of the difference of change talk and sustained talk. It is the internal debate that can go back and forth in patient for years. When dealing with ambivalence, it is important that the nurse practitioner resists the innate righting reflex. This is the reflex to tell the patient what is the right side of the argument. For motivational interviewing to be successful, it must always be a collaboration, never a lecture. Keeping this in mind will help nurse practitioners to avoid the urge to write someone's problem.
Motivational interviewing has been proven effective in many health practice areas. For a general practitioner, it can be useful in helping with medication compliance, weight loss, smoking cessation, dietary compliance, and establishing an exercise routine. For a psychiatric clinical nurse specialist or nurse practitioner, motivational interviewing is useful for identifying and assisting with comorbid substance abuse or dependence and medication compliance in patients with mental illness. Rubach, Stanbeck, Lawrenson, and Christensen performed a systematic review and meta-analysis to evaluate the effectiveness of motivational interviewing in different areas of disease and to identify factors shaping outcomes. Rubik et al. Evaluated 72 randomized control trials. Of these control trials, 3 out of 4 studies showed motivational interviewing had a significant and clinically relevant effect. Overall, motivational interviewing outperformed traditional advice giving in approximately 80% of the reviewed studies. Rubik et al. Stated that the magnitude of the decrease of body mass index, systolic blood pressure, blood alcohol concentration, and standard ethanol content is of clinical significance and implies that motivational interviewing can and should be used. Rubik et al. Determined that motivational interviewing can be effective in as little as 15-minute encounters. However, they determined that the longer each individual session and the greater number of sessions, the more effective motivational interviewing is. No studies showed motivational interviewing to be harmful or to have any kind of adverse effects, but none of the studies particularly aimed to report harmful/adverse effects. This review determined that there is a need for large-scale studies to prove the effectiveness of implementation into the daily clinical work in primary and secondary healthcare settings.
Motivational interviewing case study. This case study examines Josh, who is a 33-year-old salesman who's been recently laid off from his job. He is also recently separated from his wife and the father of a 15-year-old son. Although he has always been a drinker, he has started to dramatically increase his alcohol consumption. Josh is here today to see his family nurse practitioner to have stitches removed from his eyebrow from a fall he sustained while under the influence of alcohol. Okay, Josh, I see you're here today to get those stitches removed from your eyebrow. How have you been since we put them in?
It's been okay. It stung a little bit getting them put in, but it looks worse than how it actually is.
I bet it hurt a lot worse when the fall actually happened, huh?
Actually, I don't even remember the fall. Just woke up and my eyebrow was bleeding pretty bad. I was on the floor in the bathroom, sorry.
What was the last thing that you remember happening?
Well, I had gone out drinking with a couple of basketball friends. We had a pretty good time together, but then they started talking about how things were going at work. And I was not trying to hear that. So I left the bar and brought the bottle home with myself to finish.
It bothered you to hear them talking about work?
Yeah, because I'm unemployed right now. I got laid off a couple months back. So I've just been trying to make ends meet. Who wants to hear a group of guys talk about how good they have it at their jobs when you're the one man that don't have a job?
How has the job search been going?
Not well, I admit. I slacked off on applying a couple weeks ago. I think it just bothered me that nothing was coming through. Like my pop always says, a man without a job is hardly a man at all.
Huh. Well, when stuff like the job search and everything starts to bother you, what do you do to relieve some tension?
Well, I used to play ball with my boy, but I don't get to see him a lot anymore. Now I guess I just hang out with the fellas, maybe get a bottle or two.
And what is it that you like best about getting a bottle?
Well, I kind of like the way it makes me feel. Like, it doesn't matter how bad stuff gets out in the world. The dumb stuff I have to deal with at home. Drinking a little bit always numbs it for me. Takes the edge off. So I don't even have to think about how stuff is going for me. And it brings back some good memories for me too.
What kind of memories?
Well, memories of my pops and I. My dad wasn't around much. He worked a lot and was out a lot. So growing up, I didn't get to see him that much. But he got me my first drink when I was about 16 or so. After that, it was how he bonded, or we bonded. It was the only time we really spent together.
So was that when you first started drinking? When your pops bought you that drink?
Yeah, that was a start, I guess. but I really don't think drink that much now. Don't get me wrong, it wasn't all roses. My pops was a pretty mean guy. He and my mom didn't get along so well, and the drinking made him even meaner sometimes. But when we drank together, I don't know, it made me feel like I was a man. He respected me then.
Do you wish that you guys spent time together doing other things too?
Yeah, I wish we could have done some more stuff together, or that it didn't take all that for him to spend time with me. But nobody has a perfect childhood, right? At least he was there the same way that I'm there for my son too.
Well, that's true. Nobody is a perfect parent. As long as we all try to be the best possible parents for our kids, that's all that matters.
Yep,
So, how old is your son?
he's 15. He plays ball too, just like I did growing up.
That's great to hear. I remember you said something before about how you don't get to see him as much.
Yeah, but that's all his mom. We've been separated for about a year now, and I think he said something before about how I didn't have much to eat here, just some drinks. So now she doesn't let him come around as much. That was just one time though. You just overreacted.
Oh, so how do you guys spend time together now?
Well, we don't. I keep meaning to come to his games, but I forget sometimes. He'll be 16 soon though, and I kind of always dreamed of taking him out for his first drink then, just like my dad did me.
To have the same relationship you and your dad did?
Well, not exactly. I want to do more than just drink with him, but the drinking is a start. And wait for us to bond. We don't have much in common anymore.
Well, you might have more in common with them than you think. I know you mentioned basketball.
Yeah, that's right. We also used to work on my car together, and I'll tell him how we could work on his when he starts to drive.
See, I think you have lots of ways to bond with your son, ways that you came up with all on your own.
That's true. I guess I was just trying to do what my pops used to do about me.
Exactly. Josh, I don't know how much you drink or if you think it's too much, but there are ways to have fun that don't involve drinking. It sounds like your dad had more of an effect on you than you think.
Yeah, I guess so. I really don't think I drink that much though, and it does make me feel better. I just want to do more stuff with my son.
Well, you can do more with your son whenever you're ready. If you're interested, I know a group of dads like you that get together and talk about drinking and other things that are going on in their life.
I don't know if I want to do all of that though. I really don't think I drink that much.
Well, that's fine. I'd like to see you back here in a week or two to check to see how your eyebrow is healing, and we can talk about some stuff more then. Is that okay with you?
Yeah, that's fine.
Great. Just take your time and think about some of the things that we talked about today.